Senator, I wanted to switch to FQHCs for a minute, and I can't give you a section of the budget because I can't find anything. So and I know that you know how important our community health centers are, right? I work with one very closely, Finger Lakes Community Health. They provide tremendous coverage to multiple counties in upstate New York, but they're struggling. I've heard from them time and time again how that their reimbursement rate structure is fundamentally broken. Are there any meaningful changes that are in the budget that would improve the reimbursement structure for these community health centers?
You, Mr. President, we did add a little bit more money. Some of the, as I referred to it earlier, the MCO tax gave us a little bit of resources to be able to distribute and to invest in this. But to directly answer your question, no, we did not do something that fundamentally helps federally qualified health centers. We've tried to move legislation in the past, and we'll certainly try to, we've tried to do it again in the Senate, but we need partners. And unfortunately, we have a partner on the second floor who doesn't really help us in this regard.
Mr. President, on the bill briefly.
Senator Helming on the bill.
Senator Rivera, I think I've shared this with you before, and I think you're in agreement too, but like organizations like Finger Lakes Community Health, they have a backlog for dental care services of 6,000 people. 6,000 people waiting for services. And the fact that we can't do something in this budget to prioritize getting them better reimbursement rates doesn't speak well, I think, of the people responsible for negotiating the budget or getting this final budget in front of us. Is there any chance that after the budget that there will be some changes to make improvements to reimbursement rates?
You, Mr. President, I would respectfully disagree with a part of what my colleague said. As I will state again, the position of the Senate majority was clear in our one house, and if you go back to our one house budget, you will see that we have that we did all that we could. That we certainly tried to do more for federally qualified health centers to be able to have them be better funded. We also restructured what the original proposal was as far as the MCO tax so that more money could be invested in federally qualified health centers. Unfortunately, we do not have a good partner in the second floor. And so what our proposal was not what made it into the final agreement.
Through you, Mr. President, if the sponsor will continue to yield.
Sponsor yield.
Yes.
Sponsor yield.
Senator Rivera, continuing on with FQHCs, but moving to telehealth parity. I know that you carry a bill that would ensure that the FQHCs are fully reimbursed when conducting services via telehealth, regardless of the location of both the patient and the provider. You've heard from many of us, this legislation has broad bipartisan support. It's co-sponsored by over half the members of this body. Is this proposal to ensure adequate reimbursement for FQHCs included in the budget?
We know, through you, Mr. President, that that is a trick question. And by that I mean it was included in our one house, but did not make it to the final proposal, to the final agreement.
Through you, Mr. President, on the bill quickly in response to what Senator Rivera just said.
Senator Helming on the bill.
So, Senator Rivera, actually it wasn't a trick question. I just got this bill language, a summary of this bill language, like just a couple of hours ago. I haven't even had a chance to reach out to all of my healthcare centers to ask them if they have any concerns with the budget or issues they'd like me to raise. So it wasn't a trick question, it was serious. I am very, very concerned about our rural healthcare providers, whether they're FQHCs, whether they're EMS providers, or whether they're our local hospitals. They are struggling and they need to see increases in their reimbursement rates. So,
if I may, just quickly, and I will restate, and I will actually say that when I said trick question, I guess what I meant, because it was actually not directed at my colleague, Mr. President. It was actually directed at the second floor. And what I mean to say by that is that many of the things that you are deeply concerned about, and which we, as you know, we share the concern, and I'm going to obviously let you express the rest of them. Probably I can just tell you that most of these instances, what happened was that we fought like hell to make sure that our priorities would make it into the final agreement, and they did not. And a lot of it had to do with what happened in the second floor. So it was not meant as a disrespectful statement towards my colleague, and I apologize if it was taken as such. It was more meant to say that unfortunately, in most of the instances of things that you're going to ask, we tried like hell to get a better deal for federally qualified health centers, for doctors, for nurses, hospitals, et cetera, and unfortunately, not a good partner downstairs.
Senator Helming, the floor is yours.
Through you, if the senator will continue to yield.
The sponsor yields. Sponsor yields.
So this question is on Part FF, Human Services Inflationary Increase. Okay. So going quickly on the bill to give a little
Senator
background.
Helming on the bill.
So, Mr. President, despite rising cost pressures and workforce instability across the nonprofit human services sector, this year's 2.6% adjustment is the lowest inflationary increase since 2022. As someone who was a direct care staff for almost 10 years, I have stood with the advocates for years calling for reasonable increases. This year, I stood with the advocates calling for a 7.8% inflationary increase. The enacted 2.6% adjustment in Part FF is only 1/3 of that request. It's falling so far short of what the providers know is needed to maintain operations and workforce stability. So, Senator Rivera, if you'll yield for a few questions.
Senator yield. Senator yields.
Senator Rivera, do you know, will the inflationary adjustment be applied across all eligible contracts uniformly, or is it going to be like prorated or tiered or something by agency, by region, or by service type?
Through you, Mr. President, the original proposal from the governor was 2.1.